More than 20 individuals in the country are under investigation for the 2019 novel coronavirus. Health authorities say there's no quick way to detect the virus, at least for now. The tests that need to be done take time. Common signs of coronavirus infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. But not everyone who has flu or respiratory symptoms will automatically be suspected of having nCoV. Health authorities are after those who have recently traveled to Wuhan and Hubei, China, or worked in a hospital facility there and are showing flu-like symptoms and other signs. Medical personnel bring suspected patients to an isolated hospital facility where blood samples and swabs of the patients are collected. These will be tested for 33 common bacteria and viruses that cause respiratory illnesses. If the samples test negative, then these will be tested for pan-coronavirus. This test will only determine if there's coronavirus, but it doesn't show which strain. There are 6 known types of coronavirus. Among them, so far, the Middle Eastern Respiratory Syndrome, or MERS, and Severe Acute Respiratory Syndrome, or SARS, have recorded high mortality rates. So when a patient tests positive for coronavirus, local lab experts will then send samples to the Victorian Infectious Disease Reference Laboratory in Melbourne, Australia, for a further validation for novel coronavirus. Normally, the whole process can take about a week.
Every time we need to send a specimen to Australia, it takes us about 2 days before we arrange it with a courier and then for syempre yung government ng Australia because we're transporting potentially infectious materials.
This is why health officials are looking forward to having the country's own primer and reagents, chemicals used for tests, so they can do the final analysis locally. This can cut the process by 2 to 3 days.
We need to get hold of this so that we can already establish our own capacity to diagnose and to be able to identify that this is the novel coronavirus. If and when it does come to the country, then we did not have to send to Melbourne.
All the tests done locally are held at the Research Institute for Tropical Medicine, or RITM. Health officials warn the public not to easily believe information, especially on social media, that purportedly confirms a coronavirus case because only RITM can do this.
Sa amin lang po kayo makikinig, ang DOH. Wala na po kayong dapat pakinggan dahil kapag inyo pong pinakinggan ang iba sa labas ng DOH, ay malamang wala pong batayan, wala pong malinaw na basihan at bagkus ito po ay magdudulot ng pangamba.
Triciah Terrada, CNN, Philippines.